Welcome to Atrium Health Navicent Knows Health. I'm Cindy Busby, and I'm here today with Mr. Delvecchio of Finley. He's the new president and CEO here at Atrium Health Navicent. And today we're going to talk about his journey back to Georgia. Mr. Finley, thanks so much for being with me.
Thank you for having me, Cindy.
Would you let the viewers in Central Georgia know a little bit about your experience in healthcare and how you've come back to us here in Macon?
Absolutely. So, as you mentioned, born and raised in Atlanta, so from Georgia guy, and as a Grady baby, I've shared that before. That's my true authenticity test. But I grew up in Atlanta and did all of my formative education there, and then stayed here for college, where I attended Emory University, where I also met my wife, and studied chemistry, planned on going into medicine. Long story short, about some class called physical chemistry, kicked my butt. Loved healthcare, worked in a couple of organizations and shadowed doctors in organizations while I was in undergrad, and decided this was definitely the field for me, but maybe go a different route. And that was when I got exposed to healthcare administration. Went off to Duke University, did that, and got my master's there, and the rest is history. Went to California for a number of years, and now I'm truly, truly excited to be coming back home.
Well, as you come back to Georgia, tell us a little bit about the experience in California. I mean, certainly the differences between the two coasts, the South and the West Coast. Tell us a little bit about the system that you worked in there.
Absolutely. So I had the fortune and truly blessed to have worked in several organizations in California. I worked largely in safety net, academic, medical facilities. We're having a really strong commitment to providing high quality care, but also doing that with a mission for serving everyone, irrespective of background, socioeconomic, ability to pay, religion, all of that. You know, just a really fundamental understanding that healthcare was something that we all needed and that we all deserved, and that we wanted to make sure that everybody was getting the best care possible and equitable access to that. So I worked in several organizations throughout California, mainly in the San Francisco Bay Area, but a little while in Los Angeles too. Organizations a lot like this one. And this is why I'm so excited to be coming back to an organization that I was familiar with before I left. Obviously didn't have a chance to come down, but surprisingly know a lot of people who have worked here over the course of their careers, including a couple of the former chief executive officers that I interacted with through professional organizations, and sort of laughed and joked with two of them about the fact that all roads have led me back to Macon. So, and you know that I was and am an Otis Redding fan, so that's also really funny that the entire time I was there, I was talking about leaving my home in Georgia and headed for the Frisco Bay, and now I've done that and checked that box, and now I'm in his hometown. So that's really exciting for me.
When it comes to your work in California or your work here, we do every year or every 3 years a community health needs assessment. Mm-hmm. And you're familiar with some of the conditions and the situations our patients face here. What were those in California? Did you find they're similar all across the country, or is there anything specific about in the West Coast that might have differed with what we see here? Yeah,
that's a really good question. So it's both. There's a lot of similarities, and then there are some distinct differences. I would say from the West Coast or the Bay Area, where I spent most of my career, and here. So on the similarity piece, I would say one of the things that across the field of healthcare we've become increasingly more aware of is the mind-body connection, and behavioral health and substance abuse and other problems that a lot of us experience were as prominent there as they are here. And I think more and more, or increasingly, we're becoming aware that those things are interconnected, and you can't treat one without appreciating the other, because sometimes they are interrelated. I mean, it is often, though not always, the case that when someone, for example, gets a new diagnosis with a chronic condition, that you're not just dealing with the physical or the medical part of that condition, but then that also has an impact on someone's well-being behaviorally, well-being mentally, and can actually lead to some behaviors that may not actually be isolated in and of themselves, but be connected to the medical issue that's happening with them. So we experience that in the Bay Area. We're experiencing that here in our market, understanding that that's an important piece of ensuring health, or at least promoting health and improvement of health for our communities. On the distinction side, sometimes conditions that people experience through their life are environmental or societal, and so there are a lot of things that may be more prominent here, or at least a higher prevalence than it is in the Bay Area. So a lot more, what I learned, we're a designated stroke center, and we were a stroke center there, but here the incidence and the prevalence of things like diabetes and high cholesterol are a lot more than they may be there. Some of that is based off of your ethnicity and based off of your background. So we have a lot of diversity in the Bay Area, and a lot of people from like Mexico or other parts of Central America, where their diets actually led to healthier backgrounds in terms of incidence of lower cholesterol or better balance in terms of diets. Where in our communities, and this includes, being aware of my own background and growing up in my family, sometimes diets are not as good in terms of contributing to the incidence of diabetes that occurs. So I think some of those things are similar in our areas, and sometimes they're a little bit different.
When it comes to the things that you're mentioning, things like genetic disposition, ethnicity, demographics, what are some of the things about being a safety net hospital when we are really, our mission is to look at social determinants of health? What is it that is impacting the health and wellness of people outside of maybe even access? What are your thoughts about some of those social determinants that were in or out of your control when you worked in California, or are in or out of our control here?
Yeah, no, it's a really great point. I think they're the same, actually, in many respects there. When we look at healthcare and we look at where people's baseline health status is and what actually contributes to that, or quite honestly detracts from that, some of these social determinants that we now refer to as social determinants really come to mind. So that is not just access to healthcare, but it may be access to healthy foods, right? So if you live in what are called food deserts, where your nearest grocery store is several miles away, and also you have transportation challenges, that's going to contribute to you maybe going and seeking more of your groceries from, or your meals from, more convenient locations. The price and affordability of foods and fresh vegetables become a challenge. Beyond that, when you look at things like education and access to education and the quality of education that people are able to get, these things can also lead to not just challenges in health status and behavioral health status and attainment of health for individuals on a individual basis, but in some cases generational. Some of those, one other one that I'd mention, and there are several others, are environmental factors. So if you're living in environments where there are a lot more chances for pollutants to be a part of your daily sort of walk, so if it's like high emissions because you live near a freeway, or if it's like you live in an area where lead is something you're exposed to more, whether it's in paint or in other sort of sources. That occurs not just here, that occurs in other parts of the country as well, and it was certainly true in the Bay Area. So these are things that we always have to be mindful of, because they also have a disproportionate impact based off of where you are in the socioeconomic strata.
As we move into the vaccine phase and we're somewhat stabilizing, the mask wearing and social distancing, and now moving into vaccines, tell us a little bit about your vision for the way that Atrium Health Navicent can deploy vaccine and become part of the solution that we're seeing also across the nation.
That's a great question. So I want to start by saying that I'm just incredibly proud of and appreciative of the hard work and dedicated work of our teammates who've been on the front lines of this pandemic from day one, and really standing up in a time of great uncertainty and potentially great risk to themselves and their families to serve our communities. I mean, truly impressive hero work for our essential workforce. So I want to say that first and foremost. But that has certainly continued into this era where now we're so fortunate to have vaccines available and proliferating. The distribution channels are still quite challenged, not just here, but across the country. And so we're really working with our partners at the state and federal level to try to make that happen. As we do it, we always want to be mindful of, like we always are in healthcare, being evidence-based. And the evidence leads us to see from this pandemic that while it has impacted all of us, there's been disproportionate impact to many communities. The incidence of positives in the Latino community have been greater around the country than in other communities. The incidence of death or serious morbidity have been higher in African American communities in many respects. And so if we take that basis and say, we want to have the greatest impact, that means that we sometimes have to be more disproportionate in our efforts to reach those communities. Not to say that we exclude anyone. We absolutely want to make sure that everyone gets it, and we have to think about a lot of other risk factors. So we're looking at age and what sort of environment you're in. If you're in congregate living settings like skilled nursing facilities or senior homes, you want to make sure that we're addressing that as an area to say we need to disproportionately get to you. If you work in a healthcare setting, we need to disproportionately get to you and make sure that you are protected. Similarly, from an ethnic perspective, that we want to make sure that we're addressing those communities that have been disproportionately impacted as well. And I'm proud that we have been doing that, and I'm really proud that we're continuing to do that. We're always looking back to say, who are we missing? And we're wanting to work within the parameters of the guidelines that other decision makers have, but we similarly also work that way to influence that community and making sure that they're considering things that we are aware of and trying to balance those two things.
One of the programs that Atrium Health Navicent was interested in was a partnership with the Macon Housing Authority. For the viewers who know, here in Macon, the Housing Authority has done remarkable work, both with providing health access, wellness opportunities, opportunities for education within the Housing Authority. And I know that Atrium Health Navicent was involved in that. Can you talk a little bit about that and where it connected with the vaccine?
Absolutely. So it's along the same lines of what we were just talking about. Taking our clinicians and our quality teams and others, our community outreach team members, and saying, where is the need? And how can we be successful in meeting those needs? And taking all of that intelligence from everybody who's looking at the vaccine, the pandemic, all those things from the various angles, and saying, here's what the data suggests. Here are the communities that have been disproportionately impacted and continue to be from a vaccination perspective. So working through all of that work, seeing that, here's a way that we can actually address this gap that we're seeing here. Beautifully having our clinical leaders and others, again, reaching out to our partners, because we realize healthcare cannot be a solo endeavor. We really need trusted entities, places where people already congregate, and we don't have everyone always have to come to us. We're making that access greater in the community too, but we want to even do that by bringing it to people in many cases that address those determinants that we talked about. Lack of transportation, education and awareness about some of the kind of myths or unclear kind of beliefs about the vaccine, and then going to the communities and saying, and I'm here to help you to do it. Because it's a challenging world to navigate. I mean, in many cases, people have to register for vaccinations via the internet, and not everybody has reliable access to the internet. Sometimes technology gaps in terms of understanding how to navigate those spaces, even if you do have them, are challenges that we are actively working to remove those barriers, to actually help people to get it more. In our partnership with the Macon Housing Authority, it's helping to do that. And so we're so excited. We just started today, as you know, and we've already had some really good success. As of 9 o'clock in the morning, I believe it was, we were already putting, the ultimate goal is shots in arms. And we were already well on our way to hitting the target that early. So really, it's a partnership. So it's with the Housing Authority, but it's also with the people who actually need to get the shot, trusting us and actually saying that I want to protect myself, I want to protect my loved ones, I want to protect my community.
What is something that you would want Central Georgia to know about you as they see you in the healthcare setting, as they see you socially and they get to know you? What is something that you would want them to know?
I think what I wanted to know is at the core why I do this. This is probably what's most important. Our work, as you know, can become very technical, can become very overwhelming in terms of just the task at hand, that it is important, always important to step back and remember your why. And for me, I think I shared with you, growing up, raised by a single mom in public housing and seeing how disproportionate access to healthcare impacted in a very meaningful way, not just the lives of people who were healthy and just needed to stay healthy, but certainly if you weren't healthy or had, unfortunately some terrible accident or chronic condition, you could really not have the same chances of leading full, healthy and fulfilling lives. And so as I come back to home and come back to this community, I want people to know that my motivation is very front of mind for me, and that I look forward to partnering with and working with people, one, to gain an understanding, because I don't assume I know everything, by no stretch of the imagination. And so I love people coming to me and sharing with me what your needs are first and foremost, what your thoughts and ideas are, because it's a partnership and a collaborative, so that we can best work together to ensure that all of our communities, whether they are urban, suburban, rural, or otherwise, get the best chance that we can offer in partnership with them to make sure people lead healthy, fulfilling lives. That's plain and simple what I love to do.
Well, thank you. And thank you for coming to spend some time with us today.
Oh, it's my pleasure.
Thank you. And welcome to Central Georgia.
Thank you.
And thank you for watching us at Atrium Health Navicent. And if you'd like to know more about Mr. Finley and his journey back to Central Georgia, please visit us at atriumhealthnavicent.org.